7 horrifying mistakes doctors make during routine surgeries. Everybody makes mistakes. What happens if doctors make mistakes, or worse, surgical errors that prove to be fatal?
Number 7.
13-inch long metal retractor left inside the body for more than 2 months. In the year 2000, 49-year-old Donald Church had undergone surgery to remove an abdominal tumor at the University of Washington Medical Center in Seattle, U.S. The entire surgical team did not realize that the 13-inch long malleable retractor was missing and was left inside the patient's body. A malleable retractor is a long and slim surgical tool used to hold open the wound for surgeons to reach in. For 2 months following the surgery, Church felt excruciating pain in the abdomen and could not bend over, which his doctor brushed off as expected after major surgery. He even set off metal detectors in airports. Church went to his family physician, who felt an odd-shaped lump in the abdomen, and he ordered a scan. And obviously, the scan showed the retractor that was still in his body. A second surgery was done to remove the tool. The hospital had since admitted their negligence, apologized, and compensation of $97,000 was settled.
Number 6.
Wrong side of body part removed. Left kidney removed instead of right. In year 2000, 70-year-old Korean War veteran, Graham Reeves checked into Prince Philip Hospital in Wales, UK to have his chronically diseased right kidney removed. Instead, doctors removed his only healthy left kidney. A medical student who was in the operating theater for observation noticed the error but was told by the operating surgeon that she was wrong. Both the surgeons did not bother to read the medical notes and failed to confirm which is the correct organ for removal. Nurses only found out the error when the patient was not producing urine 2 hours later. By the time the error was discovered, the healthy kidney had already been put in a jar of sterilizing agent and could not be put back into his body. Reeves was later transferred for special dialysis, but he went on to develop septicemia, that is blood poisoning usually caused by toxins or bacteria, and his condition deteriorated rapidly, and the actual diseased kidney was then removed in a second surgery. Reeves, unfortunately, passed away 5 weeks after the first operation. The 2 surgeons were initially charged with manslaughter, but the prosecution case collapsed when the pathologist told the court he could not be sure Reeves' death was a direct result of the mistake. Both doctors were acquitted. The General Medical Council suspended both doctors for 12 months.
Number 5.
A totally wrong body part removed. Kidney removed instead of gallbladder. In 2006, an 84-year-old woman checked into Milford Regional Medical Center in Massachusetts, U.S., to have her gallbladder removed. The original plan was to remove the gallbladder with a laparoscope, which is a fiber optic instrument inserted through an incision. Unexpectedly, the surgeon found a significant amount of inflammation and bleeding and changed to open surgery. However, he misread the test results during the operation and went on to cut the right kidney instead of gallbladder. The mistake was uncovered 3 days later when the pathologist tested the removed organ. Miraculously, despite the patient being 84 years old, she recovered well, and turned out the original gallbladder that was planned to be removed does not need to be removed after all. The surgeon had since been disciplined with a suspension by the State Board of Registration and Medicine.
Number 4.
Operation performed on wrong patient and caused patient's death. Kaskela, a healthy 64-years-old lady, was admitted in a hospital in the U.S. for a simple colonoscopy procedure. Following the routine procedure, there were 2 reports generated with patient's name on both of them. One was the correct report and the other was an incorrect report. The correct report states the usual follow-up colonoscopy in 3 months. The incorrect report described an oozing bleeding mass that required removal of half of the colon. Both the reports were sent to all the related parties, including the surgeon and gastroenterologist. Neither of them questioned why there were 2 reports. An urgent surgery was scheduled based on the incorrect report. During the operation, when the surgeon could not find the oozing bleeding mass, they realized that they had performed the surgery on the wrong patient. Kiskela developed respiratory distress and ultimately had multiple organ failure and died 1 month later due to complications leading from the unnecessary surgery. What followed was horrendous. The doctors and hospital fraudulently covered up by hiding all evidence and created false records to create the impression that the surgery was intended and necessary for her proper care. Justice prevails. The Kiskela family sued the hospital and the doctors involved and won. The case was settled for a multi-million-dollar sum.
Number 3.
Operate on wrong side of the body part. Errant flip of the X-ray? In 2013, 53-year-old Regina Turner checked into SSM Health St. Clair Hospital in Missouri, U.S., for a craniotomy bypass to the right side of her brain. The surgery was meant to stop a series of mini-strokes she had suffered from during the past few years. However, the surgeon operated on the wrong side of her brain and operated on the left instead. The entire surgery was performed and nobody realized that it was done on the wrong side. As quoted from Turner's attorney, sometimes X-rays can be flipped. Sometimes doctor doesn't look at the medical records. Sometimes surgery comes off late and everybody is in a rush. Prior to the operation, she was perfectly mobile and conducted her daily activities normally on her own. After the operation, she is wheelchair-bound and her speech is incoherent. 6 days later, a second surgery was done to correct the error, but it was proved to be too late. The damage was done. Turner sued and won. The case was settled out of courts, but the details are private.
Number 2.
A totally wrong operation. Brain surgery instead of fixing dislocated jaw. In 2012, 81-year-old Bimlong Nair dislocated her jaw. She was admitted to Oakwood Hospital in Michigan, U.S., to fix her displaced jaw. But instead of fixing her jaw, they did a brain surgery on her where her skull was drilled and her brain was poked. Surgeons then realized the mistake when they found nothing wrong with her brain. Unfortunately, 60 days later, she died of severe complications leading from the unnecessary surgery. Her family sued. The hospital admitted their mistake and the family was awarded $21 million. However, Michigan's highest court overturned the award, which means the family won't get a cent, all because of a bad legal gamble. What is a bad legal gamble? In short, the family's attorney argued the death was the result of ordinary negligence, a claim that placed no cap on the money that can be awarded. The highest court overturned that by citing that they should have argued for medical malpractice, where the financial awards are capped. As what Chief Justice Stephen J. Markman wrote, it was a colossal blunder.
Number 1.
Anesthesia awareness, insufficient anesthesia during operation. Wide awake during surgery. This is a rather high-profile case where in 2006, 73-year-old Sherman Sizemore, a Baptist minister, was admitted to Raleigh General Hospital for an exploratory surgery to find out the cause of a constant abdominal pain, which was found out to be gallbladder. After the surgery, he was reported to be a changed man, behaving strangely. He kept thinking that people were trying to bury him alive. He could not sleep. He avoided being around people, even his beloved grandchildren, but yet refused to be left alone. Paralyzing drugs were administered to him to prevent muscles from jerking during surgery. However, they had failed to give him general anesthesia. Sizemore was awake almost the entire operation, where he felt excruciating pain from the time his abdomen was being cut to his organs being explored by the surgeon's hands. He heard and felt everything. Sizemore had never suffered from any psychological or psychiatric condition before the operation. When anesthesia awareness occurs, the person is trapped inside his body, unable to move, not even to open the eyes, unable to speak, but can hear what is going on around him and can feel when he is touched. The post-operation trauma got so bad that Sizemore committed suicide barely 2 weeks after the surgery. The family sued the hospital and the case had been settled confidentially. It is sad when these never events occur. However, they rarely happen. It is unfortunate when they do. Doctors are professional and it is true countless patients recover and lead normal lives after recovery. Thank you for watching the video and we hope you like it. Please help us grow by clicking the subscribe button, and if you liked this video, please click the like button.